Hello medicos, we are here to make your med life easier with our simplified notes. In anatomy, let's start with the brachial plexus. It is a very important essay question in our upper limb. So let's start with the brachial plexus. What is a definition? Plexus is nothing but a connections, network of nerves around the brachium is called as a brachial plexus. The most important components of the brachial plexus are roots, trunks, divisions, cords, branches. Let's learn them one by one. First of all, roots. Roots are from a anterior primary rami of a spinal nerves C5 to C8 and T1. What are these anterior primary rami? If you can see the cut section of the spinal cord from the dorsal and ventral root combine to form a trunks. From these trunk to arrive anterior and posterior. These anterior primary rami are involved in a plexus formation. Here from these spinal cord C5 to C8 and T1 brachial plexus. Okay. Other than this C5 to C8 and T1, if C4 is also involved, it is called as a prefixed brachial plexus, and T2 is also involved but less. In postfixed, T2 is involved. This is about the roots. Next, trunks. How these trunks are formed? Let's see. C5 and C6 primary rami combine to form the upper trunk. C7 directly forms the middle trunk. C8 and T1 forms the lower trunk. So, the trunks are 3 in number. Next one, divisions. Each trunk again divides into the two parts called as dorsal and ventral. Ventral nothing but anterior, dorsal nothing but a posterior. These divisions are in every trunk. That means 6 divisions are present in a brachial plexus. These form the cords. How these cords are formed? All the dorsal divisions of every trunk combine to form the posterior cord. Ventral divisions of the upper and middle forms a lateral cord. Ventral division of the lower one forms the medial cords. What are these cords and what is this lateral, posterior and medial? These are named according to their relation to the axillary artery. So this cord is lateral to the axillary artery, so it is named as a lateral cord, irrespective to the relations of the axillary artery. From these cords, the branches are arrived from the... What are the branches? Let's name them. From the lateral, mainly 3 branches. Musculocutaneous nerve, lateral pectoral nerve, lateral root of the medial nerve. In simplify, you remember that from L, mainly lateral pectoral nerve and lateral root of the medial nerve. Next, posterior. Posterior, you see mainly 5. Radial nerve, axillary nerve, upper subscapular nerve, latissimus dorsi, lower subscapular nerve. From the medial cord, there are also 5. Ulnar nerve, medial pectoral nerve, medial root of the medial nerve, medial cutaneous nerve of arm and forearm. If you can see here, medial root of medial nerve, lateral root of medial nerve. These two combine to form the medial nerve. And the mnemonics for the lateral cords is a M, L and M. For posterior, RAUL, R-A-U-L-L. For medial, you can remember it as 5 are present, 1 is U and all others starts with a M. These are the branches of a brachial plexus. Not only these, the other branches are also arising from the trunks and roots. From the roots, long thoracic nerve appears from C5, C6, C7 like this. And from the trunk, upper trunk, suprascapular nerve and subscapular nerve. These are the branches of the brachial plexus. On the summary, you can remember this page. This page entirely explains you about the brachial plexus. So these are the roots forming trunks and divided into the divisions forming cords. These giving the branches. These are all the nerves which supply to the upper limb, which are forming main nerve supplied to the arms. Thank you. Like, share and subscribe.